You're listening to the Cheeky Clinic podcast. I'm Dr. Chris Delp.
And I'm Cat Parker-Delp, owner of Duluth Med Spa.
If you've arrived at a point in life where good enough is simply just not good enough for you, you're in the right place.
Here we cover topics like sexual health and wellness, hormonal balance, and body optimization. And we deliver to you lessons from our travels from hard-to-get-to places around the world.
We are so excited you're here to venture off the beaten path with us into the taboo, where no subject is off limits.
Welcome to the Cheeky Clinic. Let's dive in.
Welcome to the Cheeky Clinic again. We're going to be talking about breast implant disease, a subject that's very near and dear to both of our hearts. And I kind of want to start out the episode by asking you, was there a particular time that you recognized that your implants were trying to kill you?
That's a great question. I think I should do a little backstory, I guess, as far as how my experience went in order to explain that. But I had implants placed approximately, I don't really even know the dates, 18 years ago, possibly, 18, 19 years ago. And at the time, I just had my 3 children, wanted a lift. I was told by the surgeon that they could not do a breast lift, that it had to be a lift with augmentation, is what I was how it was explained to me due to the tissue that I had. And so I went with that option. That was what was told to me. About 3 years into that, I started having a lot of skin issues. Went into dermatology, told this is psoriasis. You've got psoriasis, and we can, give you this, that, and the other. Was odd to me because I'd never had those problems before, but I didn't have any other thing to go on. So following that, a couple years later, I was having severe aches and pains, low back pain, just achy constantly, just something wasn't right. Was back into multiple physicians' offices, and then subsequently sent to rheumatology, who diagnosed me with what's called psoriatic arthritis. My belief is they looked at the psoriasis diagnosis and kind of went off of that because there was nothing in my labs at that time. When rheumatology ran all of my labs, there was nothing in that would have given them that diagnosis. So I pretty much kind of didn't really know what to do with that information. They wanted to start me on a lot of biologic treatments and things like that, which I did refuse to take, luckily. But so as time went by, I had a lot of different things that I couldn't explain. I was exhausted, tired all the time. My sleep was disrupted horribly. Was diagnosed with chronic insomnia. I thought it was due to the fact that I was working nights as a nurse at the time, but just had all of these issues that weren't explainable. I wasn't ever aware that any of these things could be related to a foreign body. And so here I am on my sleeping medication and sleep disrupted. Finally, about 3 years ago, I kept having my vision just started getting terrible. Dry eye. Went into the eye doctor, and they're like, "You've got dry eye. You've got dry eye." It was never explained to me that this could be associated with breast implants. Upon reading and just doing a lot of different research to say, what the heck is going on here? Because I can't have all of these aches and pains and skin issues and extreme exhaustion and all of these things. I just kind of delved into what this could possibly really be. And the first thing that I had found was that initially was that dry eye could be related to breast implants. And that was really shocking to me at that time. I was like, "What?" So of course I went down that rabbit hole and started, delving into things. And so yeah, that's a little bit of the backstory
So
for me.
there's a common theme that you have there, and that's that a lot of women go doctor to doctor to doctor. And did you ever feel like you were crazy? That did the
Absolutely.
As your husband, I can confirm that you are indeed crazy. But that is a common theme when women start having troubles like this. That there's multiple doctor visits
Mhm.
and multiple diagnoses that come up. Um, so, what was it that made you finally decide that all of these symptoms were related to your implants?
I think what made me finally decide was, well, one, in talking with you to say, could this be a thing? It's not a technical diagnosis, but there is a foreign body, and I could have inflammation related to that. And just the thoughts of, well, the only thing that I can do is get them out and see if this helps. If it helps, great. Um, but I really got to a point where where I felt like there was no help. And I didn't, and the help that I was getting from primary care physicians were not things that I was willing to do or medications that I was willing to take. And I felt very strongly that the things that they were wanting to put me on, um, were not things that I wanted to get to the bottom of it. I just was persistent and thinking, and something about the entire time that I was going through this, there was something that made me think this is not psoriatic arthritis. That is not what the issue is here.
So we have tests for inflammation, and your doctors obviously ran lots of tests.
Yep.
Were any of them abnormal?
Nope.
So there's so the premise is, why do we decide that this is your breast implants that are causing that? Is there some research there that shows that this might be related to breast implants, or there's some practical things? And I think when you had your implants out, you got to see the capsule that surrounded that and
Mhm,
the reaction
mhm.
of your body to that capsule. What was that like?
Um, that experience in deciding to get them out was a really tough, decision for me, but something that it was important to me to make sure to figure out what was going on. Um, I did research surgeons to make sure that I found one that did, what's called an in-block encapsulectomy. So they wanna make sure that they get the entire capsule out of that implant, because if there is inflammatory issues, they don't want anything that's inside there to get inside of your body, outside of that to get outside of that
So,
capsule.
so the once you just to back that up a little bit, so you put an implant in, and then your body does physically have a reaction called a capsule, and it's some very specific tissue that grows around the implant. Just for our listeners to know that you can't just remove the implant. That there's this capsule that surrounds that, and that this capsule. Can you describe the capsule? You.
It looks like the implant, but it just looks like tissue surrounding it, and it's hard, typically.
Mm-hmm.
It's kinda hard tissue,
It was almost crunchy.
almost crunchy.
Yeah.
Yep, you can cut it open. Now there are people that choose not to do en bloc. They choose to just have the capsule cut and the implant removed. But because of the symptoms that I was having, I wanted to make sure that we removed the entire capsule and that there was nothing about the implant itself that was left inside of my body.
Okay. Um, so uh, there's been a lot of research on this since that time. And when we talk about, well, there's no real testing, one of the more interesting things that is being done by some of the explant surgeons is they're looking for bacterial growth on these implants. And this is super interesting because the traditional way of doing bacterial growth is it's like a strep test. You swab it, you put it on a gel and see if there's bacteria that grows. And there's no bacteria that grows off of these implants. But then they get these more sophisticated tests, something called PCR testing. But what they're looking for is genetic traces of bacteria. And it's a much more sensitive and specific test because these bacteria can form what they call biofilms. And these are specific colonies that produce a film that protect them from your body from destroying it, but can still cause an inflammatory reaction. And when they do this kind of testing on these implants, they find one researcher found up to 30% of these implants had evidence of bacterial
Hmm.
growth
It's
on
interesting.
them. Which certainly can, because what we're trying to do is connect, what's causing all this fatigue. And chronic infections can certainly cause fatigue. And that was one of your most profound symptoms. So keep going. Now you went through the surgery.
Now I've went through the surgery. Uh, the one thing that was most interesting is within literally a week or two, my sleep. The first week, my sleep was bad, but I had drains in and post-surgical discomforts, etc. But my sleep improved literally almost within the first month, completely improved. No more need for sleeping medication that I had been taking literally for over 20 years. My sleep improved. My skin, my psoriasis patches, completely gone. Not a trace of them anywhere on my body at all. Some of the other things I feel like are taking a while. I don't know, how long that takes. I haven't really looked into that. Um, I do want to go back and say that I'm not against breast implants. I'm not against them. Um, I support women that want to get them as well as women that want to get them out. What I'm against is the lack of education that's given to women regarding the possibility of these issues. And I feel really strongly that that is something that really needs to be discussed in that surgeon's office, period. Um, I know it's a big business. It makes a lot of money. I think it's the number one moneymaker for plastic surgeons in the country. Um, but I think that it's something that needs to be brought up and discussed, and there needs to be more education on it so that people are aware that these are possible things, because I really thought I was losing it. I had all these things that I couldn't pinpoint anything was wrong, and nobody led me. Not one physician that I went to led me down the trail that could say, "Oh, it's possibly that you have a foreign body in your body," um, and that's something that people need to think about. I do believe there are warnings on them since I think October of 2021. The FDA did put a black box warning on breast implants, and I believe that now the consent forms, they are supposed to discuss this with women. There's also a black box warning that certain implants can cause cancers, and I think that's important for anyone to know. But I just don't think the education is there.
So the cancer one is related to the textured implants. They've established a connection there as well. And right now, from I believe that we're seeing about 1,000 implants a day is the number of new implants in the United States that are happening every day. Um, and can people all expect to get breast implant disease? It's not rare by any means, but it's not everyone.
It's not everyone, but I have been reading, and there are studies that are being done, that if you have a family history of autoimmune issues, if you have a strong connection to autoimmune issues, that you are more likely to be one of those women. So you're more likely to have issues if you have a strong family history of autoimmune. Those people should, they say, get their typically, they tell somebody getting implants, you should have them replaced every, I think, 8 years, 8 to 10, depends on your surgeon, what they're going to tell you. But really, if you have an autoimmune family history or you have any kind of issues, you should get them replaced way more frequently, say every 4 or 5 years, but to help prevent having those problems. I didn't start having issues until I was about 3 years in, and completely did not relate them to my breast. Like, who would think that I have these rashes because I have breast implants? It never even dawned on me. There was never a possibility that it could have been that. But yeah, I think that there are women that are more prone to have inflammatory responses than others. So I think that's something that needs to be explained to patients if they have a strong history of that.
So what would you have told yourself back then when you were considering getting your breast implants?
I think for myself, I would have, had I known that could be an option, I would have definitely not gotten them. I would have been the person that said, nope, not going to do that. I also would have went to other surgeons prior to listening to somebody say the only way we can lift your breast is if we put an implant in, because that's not the case. And so I think that for me, I would have said no, and I would have had gone to multiple different surgeons to get their, get an opinion from them on what they think can and can't be done.
So you have a
on
best
that.
friend who wants to get breast implants, and she's fairly certain that she wants to get them. What are you going to tell her? Are you going to tell her not to do it? What are you going to say to her?
I'm not going to tell her not to do it. I'm just going to say, educate yourself on it. Educate yourself. Dive into it. Get the information. Are you prone to these different things? Like I said, I support women without it. That's not the whole point of this podcast. Should be, I want it to be more educational, not bashing implants at all. I liked mine. I had no, that wasn't the issue. But I think I would tell her to educate, get other opinions, learn about what you're putting into your body. Definitely. And what about you? I mean, let's ask you, how do you feel? Now you don't have, now I don't have my breast implants. So do you miss them? Do you miss my body as it was?
Well, I don't miss your implants because they're right here. I put them on my desk. I've got them anytime I want them. I've got them, so I don't miss them at all. And there's a certain aesthetic that our culture pushes, and that's why we had this.
Mhm.
This is so very popular. I mean, I was a huge fan of Baywatch, and very breast obsessed culture.
Yeah.
Men tend to like breasts. That's just a fact.
Yep.
So no, I don't. I don't miss the way that you used to look at all. You're a very beautiful woman, and I don't miss your implants because I've got them. One of the things that I do think is really interesting is the fact that this whole subject isn't being embraced by a lot of physicians because you went from person to person and there's no blood tests. But along with that, I just to see how this evolution is occurring and to have an analogy that's accurate to this. I just want to talk just for a few seconds about Lyme's disease. We all know that people get Lyme's disease, that this was a real disease, but it didn't used to be. The reason that we even call it Lyme's disease is in Lyme, the town. There was a whole bunch of kids that were coming down with juvenile rheumatoid arthritis, and it was like an explosion, an epidemic. And it wasn't the physicians that diagnosed this. It was a bunch of moms who said, they were getting together and they're saying, my kid's got juvenile rheumatoid arthritis. And they started talking about it and pushing this and pushing back and saying, there is no way that all of our kids have juvenile rheumatoid arthritis. And they convinced somebody to look into it. And they found that no, this was an infection related to tick-borne disease. So we look at physicians to protect us from disease, but oftentimes the seeds of that start with the people that are suffering from that. And before then, it was just juvenile rheumatoid arthritis. And then they found, no, this isn't a tick-borne infection. And now we've got something else that we're not testing for. I don't have the tests ability to test for. And so this is, again, being driven by the women who are experiencing this. And so that's a common thing that I have to reinforce is, no, you're not crazy. Your symptoms are real. We might not have a test for them, but to embrace the fact that there's something wrong and investigating it rather than saying, you're just getting old, or this is hormonal, or you're just hysterical. All of those things. And that's coming from a physician. I want to help. If I don't have an answer for you, then then it's making me uncomfortable. Well, then I just put it on you. Yeah. You're just, it's not my inability to diagnose. It's just you. And so that's such a common theme among physicians, because we have lots of tools. We want to help. And if we don't have any answers.
Why do you think they don't know more about this, physicians? Why do you think they don't? I mean, you're right. There are women that are together now, are speaking out about this, and initially a few years ago, it was like, well, that's not a thing. They're crazy. But I've lived it. And so I can tell you firsthand, I've had a ton of changes since then. I mean, my sleep was better literally within the first month, 2 weeks of having them removed. My psoriatic patches were gone. I've lived it. So how do you get physicians to educate people on that, especially surgeons that are doing the implants themselves? There are groups of surgeons now that will not put in implants. They are only explant surgeons, and they speak out against them. And the surgeon that I went to for my explants, he won't touch an implant to put it in. He only removes them because he has seen so many issues with them. How do you educate the other physicians about that and other surgeons?
So the problem is, first of all, the symptoms are difficult to categorize. How do you categorize brain fog? And that's a common symptom for breast implant disease. But that's also a common symptom for post-COVID. It's also a common symptom for hormone imbalance. And so when you're faced with very vague symptomatology, what do you rely on? Then you rely on a test. If somebody comes in and they've got very vague kind of fatigue, maybe chest symptoms, well, then we're going to test your heart. We're going to test your lungs. We're going to test all of this. And so that's the meat and potatoes of physicians. We test. And there's nothing to test for. There's just listening. And listening is one of those things that requires time. And it requires getting to know this person. because there are crazy people out there. And to take the time to listen to you and realize, yeah, this isn't. She's not crazy. She's got all of these symptoms, and where do they go back to? And then you ask the question, could this be breast implant disease? You can also ask that, could this be post-COVID? Could this be hormone imbalance? But just listening to the patient first of all, and then also approaching this from a great deal of humbleness. I'm very well educated, but I don't know it all by any means, and our diet is evolving. Our whole environment is changing around us, and so we've got to be able to change and adapt and listen, and educate ourselves along with that. But it just starts with somebody coming up and saying, "I've got a problem," and then you say, "Tell me about it." And sometimes that requires the luxury of time. And right now, the demands on a physician, you've got 15 minutes for every patient. How are you going to listen with that? So there's an intrinsic problem with the healthcare system when I'm being forced to listen to you for 15 minutes. That's about what it takes for you to describe your lip care routine is 15 minutes, much less your whole illness routine, all of your illness symptoms, and try to connect those dots. But it starts with having somebody listen.
And I do think now that there is that black box warning on breast implants, that is helpful. I don't know how many surgeons out there are truly educating on that, but they should be. I think there should be a push for that, and more awareness about that being a possible problem that people can have, especially if they're prone to autoimmune diseases or family history of it. And it's evolving. We're finding out more and more and more all the time. So,
well, a surgeon's got to cut.
Yep.
And there's the surgical techniques have become remarkably sophisticated, and our surgeons can do some amazing things. But when somebody says, "This is what I want," and you have the skill to do that, then that's
Yep.
that's what you do.
Absolutely.
So, how would you describe it if you were going to make a movie? Is this a comedy, tragedy, horror? What genre would you throw?
I would say it's probably a little bit of everything. It was definitely a drama, a little suspense movie, a little horror movie, lots of tears involved, and then a comedy in the end when I realized it was my own boobs that were affecting me. It was my own boobs were affecting my health for the last 20 years. For 15 years, these boobs have been harming me. So, I mean, all you can do is do the best that you think that you can and get them out. But yeah, I would say it was quite a dramatic situation there for a while.
So, if there are women out there that have implants and they're doing great, then
Great.
but if there's women who are wondering if their symptoms may be breast implant illness, and they go to their physician and they're not satisfied with the answer, what do you have a resource that you guide them, or just Google it? What guidance would you give to a woman out there who's like, I wonder if this could be related to my implants?
I mean, I think that at the time people start having all of the different problems. I mean, I went to so many different physicians because it was for different things. Even my dry eyes was huge for me. So, an eye surgeon's not going to go, "Oh, well, you had these other issues. Maybe this is breast implant." My primary care, who was, would offer medications that I didn't want to take for psoriatic arthritis, didn't look at didn't piece it all together. So I think that um, really there's not really one good place that you can go for that, sadly. I don't know. What I would tell women is just to um, look at look at all the different options. If you think it's inflammatory, try an immune diet for a while and see if that helps. Is it something you're eating? I mean, I tried all the different things. But I think just researching and um, talking with other people who have had those exact same things. There's online resources, groups that people can join to discuss that. Um,
That's such a good point.
yeah,
You go to the eye doctor, and what would you think if the eye doctor looked at your eyes and said, "Do you have implants?" I mean,
and
you
and
you'd be
that's
like,
part of it that I
"Mm,
wish that all the inflammatory issues that it would have just sparked one physician to say, "Oh, you have a foreign body in your body. You probably have some inflammation related to
mhm."
that."
But
But it just didn't. They just didn't look at that. They don't, and it is a foreign body.
mhm.
No matter what, it's a foreign body, and your body is going to react to a foreign body. Um,
But that's the part of the problem with specialties. You go to a skin specialist, they're not going to talk implants when they see a rash. An eye doctor's not going to talk implants when you've got dry eyes. Neurologist isn't going to talk
Implants when you have brain fog.
if you've got brain fog. And so this is something that you have to advocate for yourself
Yep,
and educate
absolutely.
yourself and see. Um,
And I felt like at least I had a good support system in you to say, "Look, I've exhausted all of my resources here. What can we do?" Because something is not right. And it was, it just got worse and worse after the third year with them. Each different symptom that I had just continued to, they just continued, the list kept growing. And, now it's nice to see that list going away.
one of the principles that I've always embraced is if all of this is progressing and and things aren't getting better, don't move forward. Walk back, and that is kind of an essential part of being of diagnosis is it's always about the story. It's not about your rash. This go back, walk back,
Mm,
and keep walking back, and then maybe you can find the path forward once you walk far enough back to get to the bottom of the story.
right, right. So, and it is nice to be able to put different clothes on now too, as opposed to like the shirt I put on this morning, and I put it on and it was kind of tight, and I said, Jesus Christ, how did I fit in this before 3 months ago? And you said you didn't. And you're right, I
Uh,
didn't. But, they got in the way of a lot of things. So I'm actually very pleased with having an explant and getting a lift that I was told years ago would not work for me, but it has worked for me. Exercise is easier. They're not in the way. I can wear much cuter things and feel a lot more confident that I did not have breasts that were larger than I should have had for my body size as well. So that was important to me.
so if a woman is considering and has gone through this process, are there certain surgeons that you would recommend? What should she be Googling? What should she be looking for?
I would find a surgeon that only does explants,
Mhm.
myself, that they specialize in block encapsulectomies, because you want to make sure you get that entire capsule out. But I would definitely go to a surgeon that is all that they do. All they do is explant, 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 because they have um, the knowledge base to make sure you can get the lift that you want, and that's what they do. So you go to the person that does it the most, in my opinion.
Mhm. Excellent. So what are you going to do with your implants?
I'm not sure. I think I'm going to leave them for you to play with in case you ever have the need.
Yeah, when you go on your trips,
Yep.
yeah, I play with them. uh,
All
well,
right.
thank you for sharing your story. It's a hard story to go through. You went through many years of this, and I hope that the women out there that are that have implants. Again, this doesn't happen to everyone, and there's certainly we're not trying to discourage anyone from doing it, but just encouraging people to read and know your risks. Like any surgery, you should know the risks and the benefits. But if you are thinking that you may have symptoms of breast implant disease, then it's worth looking into.
Definitely.
And the explant surgeons are good resources. The internet is a great resource. But even if you just Google explant surgery, you'll be able to find a lot of the symptoms and potentially a cure for you.
Yeah, that's what I would say. Yeah, definitely.
If there's any questions, feel free to reach out to us. We're always happy to discuss. And thank you for joining us.
Thanks for joining us on a cheeky adventure through the world of wellness. Follow our spicy tips, laugh out loud stories, and expert advice designed to keep you feeling youthful, vibrant, and always in the loop.
Follow the show so you don't miss a beat. Stay connected and let's keep the fun going.
And if there's a subject that you'd like to hear more about, please let us know. You can connect with us by clicking the contact link below or send us a message on social media.
Make sure to send this episode to a friend who could benefit from today's topics. And don't forget to leave the show a 5-star review.
Thanks for listening to The Cheeky Clinic. We'll see you in the next one.